Welcome to Healthwise here on WTVI. I'm your host, Joey Pop. Our topic is a new one for the medical broadcast. We're about to learn about and understanding sedation dentistry. Research shows that 30% of the population avoids the dentist due to fear. Well, with us today is Dr. Edwin Porter of Cosmetic and Restorative Dentistry. He plans to explore with us what can be done for patients who are reluctant, afraid, or anxious about undergoing long and complicated dental procedures. So we're calling this episode Sedation Dentistry. Relax and wake up with a new smile. We welcome your input during the hour by telephone or internet. You can call us or email me at jpop@wtvi.org. Welcome, Dr. Porter.
Thank you, Joey. Thanks for having me.
You know, when we booked the show, and Suzanne Milkey is our producer, and she does a great job finding guests like you. I told her, I said, sedation dentistry, I'm totally clueless when it comes to this topic. So I'm going to be your biggest viewer here, hoping to understand why someone would undergo sedation. Right. So initially, what is, I can understand being afraid, right, having anxiety about going to the dentist, but to actually go under sedation, why would someone do that?
I think so many of us have fears from childhood that stemmed from childhood dental procedures that have just stuck with us. I mean, I'm the same as anybody else. I have the same thing that's happened to me, and I think it sticks with you for a lifetime. And unfortunately, right? Yeah, unfortunately, it just keeps you from seeking dental care. And there's quite a bit. The American Dental Association probably estimates 25% of the population doesn't even seek the dentist because of that. So it's a large number of people that are undertreated or unserved.
And just like making sure that you get your eyes treated regularly, it's so important to get the teeth treated regularly.
Right.
So for those who are cheating themselves because of fear, right, this is an option?
Without a doubt. So many of us are reading in the literature today, even in the newspapers and definitely on the internet, the link between gum disease and low term weight babies and just
heart disease too,
heart
right?
Disease, general health. Your heart is affected by periodontal disease. So there's a lot of links between dentistry and the lack thereof and just general health. So it's a big deal. What
happens if you let a cavity go?
Well, obviously the worst case scenario is you lose the tooth. Rarely anybody dies from a dental tooth loss, but the worst case for us as patients is we lose the tooth. And there's options to replace the tooth today, but I think losing a tooth is the worst case there.
How about infection, or if there's infection that reaches the nerve? What happens with that?
You can end up with an acute toothache from something like that, without a doubt. So you get a toothache that causes you to pick up the phone and call a dentist because you're in pain.
Is that an abscess?
It can be. An abscess typically involves infection at the tip of the root.
See?
Yeah.
And what could happen if you ignore that?
Well, you can end up in the hospital. Yeah, you can end up with quite a large infection that has to be drained, usually by an oral surgeon in a hospital setting. So it's not a fun event. So the unfortunate thing about dental issues is they don't fix themselves. So you can't
ignore it.
Can't ignore it. You'll end up with bigger problems down the road that have to be dealt with.
Okay, Dr. Ed Porter, let's hear a little bit of your background. You grew up in Charlotte. Your dad's an MD here in town.
Yes, my dad just recently retired. He was an MD here for 40 years, and he just recently retired. I have two brothers. One's a dentist here in town as well, but we natives of Charlotte. I was born in Virginia but raised here in Charlotte and spent my entire childhood here. I left to go to college and dental school, and I've been back ever since.
So what made you pick this specialty? You alluded at the top of this show, perhaps as a youngster there's been fear for some people. Were you one of those folks, or was this something you thought, gee, I need to go into this profession?
Yeah, I don't have a good answer of how I ended up in dentistry. I knew I wanted to be in healthcare in some way. I knew I didn't want to do what my dad did.
Your dad just retired?
Yeah, he was an OBGYN here in town. So I knew I didn't want to be up all night delivering babies, but I mean those guys are unbelievable. But I wanted to do healthcare. I felt like this was a good fit for me. I wanted to use my hands, and I wanted the variety too. That's the neat thing about general dentistry. At least you have a large variety of things you can do. So,
right. And we've had your colleagues on the air, and when I have the dentists on, it's like you guys are like artists.
It is.
Do you
like
look
an
at
art.
yourself that way?
Well, it's an art and a science. I think you have to obviously know the science, but you have to have definitely an artist's view at things. If you're dealing with teeth and the shape of, form and function follow each other, and you have to be able to do that in people's mouths. So you're dealing with tiny things too, so it's not the easiest profession.
And so the whole idea of today's show is to bring that anxiety at its lowest level by visiting Sedation Dentistry. So let's learn all about it, shall we? All right, Dr. Porter has brought us some slides to help us understand this. So let's go to the first slide and get underway. Sedation Dentistry, fear, there you go.
Right. I think that's probably the biggest draw towards sedation dentistry, is the fact that as patients that are highly anxious about dental work, they can seek us as an expert in sedation dentistry. So I think the biggest thing to draw from this slide is the fact that there's so many underserved people out there. There's a huge segment of our population that's lacking dental care.
And it goes across the board.
Without a doubt. There's no particular person out there that's like that.
All right, and that emotional connection. So here we go. Oral sedation advantages. What are the advantages of having sedation?
Well, oral sedation in and of itself, we're giving something by mouth. So we use a pill in my office, and we don't use needles or syringes or anything like that. There is some equipment, but it's more as a monitoring device. That's it.
All right. Let's go to the next slide. The disadvantages of being sedated.
Right. Well, I think whenever you're not using intravenous sedation, you have the inability to rapidly turn something around. So there are some disadvantages to using oral sedation in that you can't, turn things around immediately. You're using a pill that's being absorbed in the GI system and going through the liver to be metabolized. So there's definitely an issue with prolonging the duration of sedation.
All right. So going back to the disadvantages, how long does it last, the sedation itself? And could that patient drive home?
No. Patients that are sedated with the pill that we use cannot drive home. They have to have somebody take them home. The peak is about an hour. I'm sorry, the initial onset is an hour. The peak is around 1.5 hours, and it usually lasts about 2 to 4 hours.
Well, that's very similar to someone being given the Novocaine.
Very similar, yeah.
Huh.
Yeah. Usually they're wearing off at the same time.
Is that right?
Yeah, so that's a good thing.
What are the risks of being sedated? There are risks to having the Novocaine.
Right.
The nerve could be pierced, and that could affect some permanent numbing sensation.
I think one of the biggest things that patients out there need to know is the screening has to be very careful. You have to screen these patients. You have to make sure that they're healthy. The biggest things that we can get in trouble with oral sedation and dentistry is not screening the patient. Picking up, trying to do this on a patient that has multiple medical issues that really don't need to be treated in an outpatient setting. They probably need to be treated in a hospital.
Well, that was my next question. Who is the ideal candidate?
Well, there's a slide that's going to come up that talks about the American Society of Anesthesiology has.
Well, then hold off on that. Let's just go right to the next
Yeah.
slide then, and we'll get to it here in a second. This next slide is some of the medication that you were talking about.
Yeah.
And I think you also brought something on set here. But let's talk about some of these bullet points.
Well, I think the biggest thing that we need to know about this medication is it's been around forever. It's a family of medications called benzodiazepines and Valium. Everybody's heard of Valium. That's one of these types of medications. The particular medication that we use is triazolam, and we use a very, very small dosage of this medication. But it's very unique in that it doesn't have a half-life. That's probably the biggest thing that I tell patients.
What does that mean?
That means that once it's metabolized through your liver, unlike Valium, the metabolite in Valium is active as well. So once this passes through your liver and is metabolized, there's no other reaction towards the drug. So it's a one-pass drug.
Okay. And then you brought it on set here. Prescription medication?
It is, yes. It can only be prescribed by...
And it's quite small.
It's very tiny. That's the only reason I brought it, because it's a very, very tiny pill.
Yeah.
All right. See that or not?
Sure, we can see it right there.
And I think
so it's just one pill, and that would be it for the sedation?
Right. Well, no, we titrate